This conference will now be recorded.
Welcome to Dr. TSPR show. This is Dr. Tangella Shiva Prasad Reddy alias Dr. TSPR. Namaste, Adab. Hello. A warm welcome to Corona topic, COVID-19 topic again. Let me introduce the guest of today is none other than Dr. Amitav Banerjee. He is professor and head community medicine and clinical epidemiologist, Dr. D.Y. Patil Medical College, Pune. So he is our esteemed guest today. Again, the topic is very clear. Did world ignore public health principles? How dangerous corona was? Was it more deadly and harmful than the other prevailing existing seasonal diseases? That is very, very pertinent. 99.99% they were recovering. That was the official word. Then what happened thereafter? Why this fear psychosis? Why so many got hospitalized? Why so many people died? Is it just because of corona? Where are the autopsy reports and so many and so forth? 27,000 people in India die daily. How many are being accounted in the name of COVID-19 or corona? That's a big $1 million question. So, under this fear psychosis, different parts of the world, how people started to react, after understanding what this pandemic is all about, why these mandates, when we say pandemic, the entire world is involved. Since January 2020, now we are in September 2021. The natural immunity and through that the herd immunity, those infected recovered, those who were there associated with those infected, still quarantined and recovered people like us, without vaccines. Vaccine is a prevention. Vaccine is not a medicine, kindly understand. In spite of that, people started to move around happily. But why this vaccine scare? So that is to clear the confusion prevailing. We have selected this topic once again with one of the senior most epidemiologist and community medicine professor. Welcome to this special show, sir.
Thank you, Dr. Reddy, and I thank Dr. TSPR. Good evening, viewers. It's my pleasure to say I wouldn't say views rather. There are too many experts and too many expert views which do not last long. So I would be just as a simple public health person, as a traditional public health person, I would say, of the old times, I would be just asking some questions, sharing some questions to provocate critical thinking. I want all people, and it's not rocket science. I would just present the way epidemiology and public health is practiced, and it requires more of common sense than complex models. So we have been misled by the complex model. So I'll just try to give a small presentation and then we can take the discussion further. So I'll just share the screen and let's see how it proceeds, the discussion. So this is the topic today. This is the main topic. Did the world ignore public health principles? And subsequently there will be a set of other questions. So this is the way, this is the approach of epidemiology and public health, asking questions related to health events. First is, what is the event? What is the magnitude? As Dr. Reddy also mentioned, how many people are dying? How many people are affected? How severe it is? And who are the ones who are getting affected? Any particular age group, any particular race, different countries are having different experiences. As we will go, we will see that the impact was not similar across different countries. But somehow the method of control was one size fits all. So we will see whether was it logical or different countries could have gone different ways to cause less of collateral harm So we will just see, we will be guided by the data and where, when, and why. Then asking questions related to interventions. What can be done? How to prevent in future, and what difficulties this action had caused. So this will be the scope of our discussion. So as we know how it started all, this is the first question. This is the first epidemiological question. The consensus initially was that it was the coronavirus jumped the species from animal to man from the Wuhan seafood market. So this is the attributed to be the ground zero. But subsequently, there were certain doubts. Even Indian scientists had expressed that it might have come out of a lab in Wuhan. Initially, it was discredited. This opinion was discredited. This was censored, and none other than Fauci said this is ridiculous. Subsequently, again, there was a flip flop that there may be a possibility. Again, there is a we don't know. So we don't know. Equal chances, 50-50 chances, whether it is a natural evolution or it is by some gain of function research or some manipulation, whether it has escaped from the lab. Gain of function research is trying to raise the transmissibility or lethality of naturally occurring viruses. So this is one theory. None other than a famous journalist as Nicholas Wade also has expressed his concerns that it may have come out of the lab. But still there is no transparency. Still we don't know. So we leave it at that. Whatever it is a coronavirus which has got certain features. We'll see. And like other coronaviruses, it is behaving like other coronaviruses. So it is, some of the reputed virologists say that it is not exactly novel. It has evolved from other coronaviruses. And in fact, those who have got earlier infection, they get some protection. So anyway, that is again a debatable topic. So we'll just see how the public health principle started getting violated from the very beginning of the pandemic. It started in China, in Wuhan, and China put one district, the Hubei district, which included Wuhan, under lockdown. And when China did it, the whole world criticized China. Even the WHO criticized China, and it said that this is something which the WHO never recommends, this lockdown and restrictive measures. And legal experts all over the world said this is unconstitutional and unscientific. So you see, this is what was the prevailing WHO guidelines. If you see the old WHO guidelines pre-COVID, nowhere they recommended lockdown because of the collateral damage. And when China did it, they criticized China heavily. It is on record. Then the pandemic progressed to other countries from China, and WHO declared COVID a pandemic. And the very countries which had criticized China, harsh measures, surpassed it in implementing more crude and extreme forms of lockdowns. China had only locked down one district. The first country to lock down the whole country was Italy. And experts advocated this as a norm to flatten the curve. Many jargons have come up across the way. New jargons have come up. One of the jargons was flatten the curve, then break the transmission. So as we see, the number of jargons are coming up. So experts advocated this. Actually, what happened, we'll see. There was initial panic and chaos. And a lot of social media also, it showed a lot of people dropping on the ground in China and all that. Some of them were fake, and a lot of cremation and other things. So from the very beginning, the public panic was kept at a very high level, and it continues to this day. And why it occurred? Misleading cues and global panic, chaos and anarchy. Lethality of the virus got overestimated. What happened? From China, the first country to affected was Thailand. There was not much mortality in Thailand. And then from next country to affected was Italy. Italy has got a different demography. It has got a very elderly people. The median age of deaths in Italy from corona was 80 years. Large number of elderly people in nursing home people, old age home, they got affected. And due to some initial lethality was also due to mismanagement. They could not protect the old age homes. subsequently, or even data was there from China also, that it affects the elderly, like any viral infection. You see, in those days also, we were told any elderly person gets bedridden, he or she succumbs to the prevailing viral infection, whether it is influenza or a common cold. The data is there that even a normal common cold virus, the fatality in elderly people who are bedridden and frail is 8%. Even if an elderly person bedridden gets infected, the fatality is 8%. So this initial deaths in Italy was among 80 years plus, and the paper appeared in Lancet that the mortality of this coronavirus is 20%. Published paper 20%. That's one, and the Middle Eastern respiratory disease is also a serious issue. But there were initial subsequent studies by even Professor John Ionitz and Jay Bhattacharya. They carried out a sero survey in California, and they found that large number of asymptomatic and mild infections are many times more in the community by sero prevalence studies, and they were discredited. I don't know what was the pattern. This even John Ionitz study was discredited, criticized. Subsequently, again, he did the meta-analysis, collected all the seroprevalence studies, and the WHO, as on today, the case fatality rate, WHO says it is 0.3%, or it is even less than 0.3%. The, that is because of the majority of the cases, particularly young people and all, are asymptomatic or mild cases. That increases the denominator. If you are taking only hospital admitted cases, the denominator is only severe cases. So initial, and based on this, the mathematical models were projected. Based on the data from developed countries where the mean age of population is very high, they projected that there will be a global deaths, millions of deaths, and that raised to the panic of all countries. And in the ensuing care, after Italy did the lockdown, country after country started doing the lockdown. And this was one of the public health principles which was breached, I would say. Like in public health, you have to see the local epidemiology, how the virus is. Like initially in Asian countries like Thailand, it did not cause high mortality. So the public health people should have analyzed the data. They should have seen that yes, it is only in the countries where there are very high elderly people, the average age is more, and subsequently we have got more data. So policy should have changed. Policy should have been flexible depending on the then prediction based on mathematical models without proper epidemiological information. You would be surprised to know that most of these measures like lockdown, restrictive school closures, where is the evidence that this works? You will be surprised to know this evidence of computer simulation models. And you will be more surprised to know that this lockdown and school closures, the models were made by a high school girl, 11th class high school girl as a school project. Because influenza, they wanted to see models, they wanted to make simulation models as a school project. So she made some models to control influenza, another viral infection. And they made mathematical models that if they do lockdown, if they do school closures, if they do the social distancing, 6 feet, and from the mathematical model, they predicted that they will break the chain of transmission. So these mathematical models are computer models. Here, human beings and society are taken as units, inert units. But in real life, people are social animals, social beings. They interact, they cannot be insulated. So what works in the model, in the mathematical model, and does not work on the ground. For public health, for epidemiology, you have to collect data from the ground. Not only data, you have to see the social conditions, how people live, how people work. You see, in developed countries, the population density is very less. Social distancing and other things are possible. In developing countries, there are so high density in population. Even middle class houses are crowded. If you do lockdown and other things, you are increasing the transmission. People in slums live cheek to jaw. In one room, 10 people in slums. If you do lockdown, it does not. It increase. You are just blindly copying. So these are the public health principles which were ignored. Public health is you see the big picture. You just don't copy off the shelf from other countries where conditions are different. So anyway, that's why we have got so high seropositivity. As on today, perhaps India has got the highest seropositivity from natural infection because of the high density and perhaps the keeping people packed inside.
Dr.
So
Banerjee,
even in this modern
Dr.
world,
Banerjee, they want your
yeah,
voice to be increased. They want the mic to be nearer to
yeah,
you. Many are requesting that.
okay, okay, okay. Can you hear me better now?
Yeah, I think you just make an effort.
Yeah,
They
yeah.
they will write.
So yeah,
They are
this
following
as
you.
I was saying, the different social epidemiology aspects were not taken. Computer models are sitting. I call them the mouse click epidemiologists. In the old days, as I said, I am a traditional epidemiologist. In the old days, we used to go field visits, house to house surveys and other things, see how people live, work, how they stay. Then we had the armchair epidemiologist who was just sitting in the armchair and making. And now we have got with this computer and digital revolution, I call them the mouse click epidemiologist. They are just sitting and making computer models. And I just said these lockdowns and social distancing school closures were based on a high school project in 2015 by a girl whose father was a scientist in one of the institutions of America. And then he took it forward and gave this proposal that if we close schools, if we do lockdown, we will break the transmission. So you can imagine how fragile is the evidence without any data from the field, without any seeing what are the conditions in different countries, without study of different societies, different cultures where people stay together. You have put this sitting in the with the computer models, and it causes major harm. In fact, without considering what harm it will cause to other non-COVID conditions. Public health is not about one disease. Public health is about other diseases also. So this is what I was trying to say. Then other things also, according to the precautionary principle, I have not nothing against mask, social distancing, test, trace, and isolate lockdowns. I have nothing against it. Initially, when the concern was that the fatality is high, 20%, it was justified, which is known as the precautionary principle. But after that, the data should have been collected, research should have been done whether masks work or not, whether social distancing work. Firstly, whether it works. Secondly, whether it is possible. Can you really tell people to be always 6 foot? You carry a scale and see you are 6 foot away from other people, particularly Indian conditions. I read somewhere that if you have a social distancing or physical distancing in India, you will reach other country because the density is so high and people are so much in the developing countries that it is just not practicable. Then test, trace, and isolate also. These are okay when the epidemic is new, when it has not spread. Once there is community transmission, you are just wasting your time. It is evidence shows, even the old WHO, I have got a WHO guideline of pandemics. Even the WHO guideline says that test, trace, and isolate are initial phases. Once the community transmission has taken place, it is not possible to. And the recent Sero survey also shows the fourth round of Sero survey, 92 crore Indians have got IgG antibodies. And when the survey was done, only 5-10% were immunized. You cannot say it is due to vaccine. Almost 80 crores Indians got the antibodies from natural infection. That is a very hard data. When this fourth Sero survey was done, almost 67-70% Indians are having the antibodies. And that time when this survey was conducted, the immunization coverage, vaccination coverage was just less than 5 or 10%. So majority had got it. 90 crores Indians have got the natural infection. At least 75% or 80, at least 70 crores or 80 crores have got it from natural. 80 crore Indians. That means the infection has spread among 80 crore people. And as on today, we have only identified how many people? The world has identified 20 crore people. 20 crore or 20 crore plus people have been identified as cases in the whole world. That means one country, India, has got almost 80 crores. And in India, about only 3 or 4 crore people have been identified as cases with this test trace. Means you are only identifying 4 or 5% of the cases. The amount of money wasted in contact tracing, amount of stigma, whoever comes positive is labeled as a case, just because asymptomatic person also. So that person faces stigma. And 75% of the positive people are roaming in the community. And those who are found positive, some people have committed suicide, some have been removed from family, some have had social stigma, some have gone to depression. And this is the first time, this is against all principles of public health. Even the WHO book mentions that when community transmission has set in, this testing, tracing, isolation does not make, because already, and data is also showing it. So still we are continuing it from one state to other. You still continuing it. And other principle of public health is we have been knowing since ages is that when you are going to a virgin land which is not having the infection, then only the test trace is important before entering that or quarantining them. Like a person has coming from Africa, he is shown to India, yellow fever vaccination is seen, and if he doesn't have, he is quarantined. But when the corona is spread all over the world, and particularly India, when it is in all the states, this interstate travel or international travel and asking for the certificate of vaccination or asking for RT-PCR is against the public health principles. I am ready to, anybody can debate it, we can discuss it. So as I said, these are the questions, but it is wasting money. Firstly, resources are wasted. That same money could have been used for making the preparation for moderate and severe cases. We would have less deaths, actually those who need it. Here, what happened even in the second wave or in the first wave, mostly in the second wave, 80-90% of asymptomatic people, mild people were admitted in hospitals, and that hospitals got crowded. So if we had not created this panic, probably our death rate would have been still lower. I am not saying that corona is not a disease. It is a disease, and it can be severe in people who are elderly, who have got comorbidities. So had we focused on that, so what we are trying, we want a zero COVID, which is not possible, particularly majority get mild and asymptomatic. So these measures should be reviewed periodically in light of emerging evidence. Similarly, a mask also. There was one randomized trial in Denmark which found no difference. So that study was not given much importance. Recent studies in Bangladesh, it is showing yes, mask will prevent. That is given a lot of yeah. But if you see mask trials, only 11% difference was found in the group using mask and those not using mask in Bangladesh. And in Denmark, they, under study condition, they did not find. Okay, even if I say under study condition, mask work. But if you see the social epidemiology, if you see people in all poor people, could they afford to wash the mask? Could they afford to change the mask? Even in a middle class house, even in my house, people come and put the mask. When we go out, we don't know whose mask it was. There's a mixing of mask and other things. So I am concerned we may be preventing COVID from mask. I am not saying it, but when you go indoor, you take down the mask. Outdoor, the police is catching. Outdoor transmission is zero, nil. And outdoor, even the caller tune says कि बाहर निकलेंगे mask पहनेंगे. So this is again public health science and public health principle. And police will catch you outdoor. And in the slum, people are indoors without mask. They can't wear mask 24 hours. I mean, that you have to see the social air. And whether the masks are not changed. Even aprons, they have done studies earlier that apron carries the germs. So similarly, mask is near the mouth and throat and nose. Whole day they are getting wet with sweat. And it is not changed. Every 6 hours you should change the mask according to scientific principles. The poor person, can he change after 6 hours? Whole day is working with mask, and there is sweat, there is detox, there is saliva, and that can give rise to fungal infection. I don't know. I have talked to my microbiologist friend. I don't know whether the second wave may fungal infections can it be a mask. He says we cannot think of doing research on this because it is considered as a holy thing. If you just suspect the mask, you will be saying, this is, you are anti-mask and that. So therefore, I say, as a public health person, as a scientist, we should explore everything. Whether mask is okay, under study conditions, mask may prevent, but under practical conditions, whether mask can work with cleanliness, although it can cause the bacteria and germs inwards. I have spoken to my microbiologist friend. She says it is all your inside of the mask contains all your pathogens, outside of the mask collects all the pathogens from other people. So mask is full of pathogens inside, outside after you wear it for 6 hours. So mask can work under study conditions. Similarly, lockdown, as we will see from the data, we will see there are some countries, very few countries like Sweden, Belarus, Japan, they did not have lockdown, and their rates, deaths per million population are more or less same depending on which culture they are coming from. So there are a lot of cultural differences, geographical differences in death rates. We will just see, I have got some comparative data. So as I said, there are some notable exceptions. Sweden, Belarus, no lockdown, no mask mandate. Sweden did not have a mask mandate. And Sweden, very important thing now, since we are concerning of school opening or reopening, this Sweden experience is very important for us. Sweden did not close the school throughout the pandemic, and Sweden rates were much higher throughout than our rates. I mean, not Sweden exactly, European rates were much higher. In fact, compared to other European countries, Sweden rates are lower than those European countries. So there are certain features of Europeans and Americans which makes them more vulnerable. Firstly, one is the age, other is the obesity. These two factors are coming up, as we will see from some charts. So Sweden kept the school open, and Sweden, they did not have any high mortality in school children during the pandemic, neither in the school teachers. So they did not find that children are transmitting to adults. And children, the death rate from COVID, they did a meta-analysis of 7 countries. They found the death rate from COVID was all the deaths in children only 0.3%. 99.7 or 99.6% deaths were from other conditions in children. That is, most common was the accidents. Then other respiratory illnesses, including influenza. In fact, normal H1N1 influenza is more lethal to children. And diarrhea, and in fact, in our country, every day we lose 2,000 children from preventable disease. I don't know, many people are not aware of it. Many doctors perhaps are not aware of it, that every day 2,000 children die due to preventable diseases. Asia, Japan did not have lockdown, and Japan has got a very, very interesting thing. It has got the highest age, but it has got low mortality, we will see, because its obesity is very less. And these, of course, these were the, from the data, global data, we know uncontrolled comorbidities, diabetes, renal disease, obesity are the major. Particularly obesity is coming up in a big way, and similarly diabetes, particularly in our country. And these are the people which are mild or asymptomatic infections, the children, young adults, healthy elderly with no comorbidities. So as I said, I sometimes say the public health and epidemiology is just like a game of chess. This is from Vishwanath Anand, who was the world chess champion, that in public health, you cannot, just like a good chess player, cannot play with just one piece. What is happening is now Corona has become the queen, and like a novice new chess player will always play with the queen. But other pieces on the board are also important. Other diseases, particularly in our Indian countries, developing countries, the other diseases are other pieces. Sometimes the other things can also block the queen. So what? So this is Corona is queen. So what is happening if a beginner plays only with queen? Even with the queen, you can lose the game if you don't take care of your position, of the situation in each chess game. Each chess game is different. You cannot, the same pieces are there, but you give it to different players, they will play differently. Similarly, the guidelines from WHO, FDA and all cannot be applied blindly to all countries. Each country it is something like a new game of chess or new chessboard. So epidemiology and chess has got a lot of similarities. You have to see the whole board. You can't keep your attention on one piece. We will lose the game. That is what is happening. Public health is not only, it contains all diseases and you have to prioritize. So as I said, in our country, major cause diabetes, vitamin D deficiency. You see, again, public health means good health. When you do lockdown, you have put people indoor. They get vitamin D deficiency. We have done studies otherwise also. Before the pandemic, we found that younger generation, it is published study, younger generation are having 4 times less vitamin D than the older generation. So younger generation, as it is, they are not playing much. During the lockdown, and vitamin D is related to overall immunity, general immunity. Diabetes, we did a study before the pandemic, we found diabetes is in younger population, even in rural areas. In rural areas, we found 50% of the young diabetics, that is 35 to 45 years, are not aware of the diabetic status. 10% of the population diabetic, they are not aware of the diabetic. And in the second wave, we had a high incidence of mucormycosis, maybe due to hidden diabetes. Sometimes many deaths have been attributed to he or she didn't have comorbidities, died. Probably that person never knew that he or she is diabetes. So this is a major problem in our country. These are the disadvantages. And many are unaware. And risk factors for diabetes is also younger age groups compared to the Western. Because of a certain genetic predisposition, we get diabetes and coronary arteries hypertension a couple of decades earlier to the Western. So these are all public health principles which we should see if we have to control COVID here. Instead of chasing it blindly, we should identify all the diseases. Particularly, we don't have, in the rural areas, we don't have screening and treatment for diabetes. So these are the things which can increase the mortality from even any viral disease. It may be COVID today, it may be some other disease tomorrow. So as I said, the social changes, this is social epidemiology. We have to see the whole chessboard, the physical activity, open air and vitamin D. In our time, we used to go on cycle. Now, young people from college, they are going in cars. They are sitting indoors, no vitamin D, overcrowding. So this is how the social changes are important. This is the workplace. Open spaces were there. Now it is cubicles. There is stagnant air. So all these are ready for a communicable disease to happen. Healthy diet, Japanese diet. Have I missed one slide? I think I had a slide on the comparative data. I don't know. I have missed that one slide. I think it got deleted.
No problem, sir. Take time and
I have got
check
a very
it.
interesting slide.
Take time and check, sir. Take time and check. No problem.
I will just share another here. I had a very good slide, which was the most important slide. I think I have just skipped it after I revised it. Let me see my whole presentation. Just see.
It's very, very important.
Or I can just
Take time, sir. No problem.
just a minute. I'll just see if I.
Take time. No problem.
Again, I have to see well.
Because you are doing wonderfully well. Such basics people forget. The scientific people,
No, that slide
ICMR,
is
DCGI, and the
very
world over
important,
WHO, who not? Mechanized minds, they are trying to dictate terms on science and public health principles. Very sad state of affairs in the world. A disease wherein only 99.99% would recover on their own through natural immunity more than 1 year since. It is creating havoc, creating fear psychosis, and health issue has become a law and order issue into the hands of police. What knowledge they have, I don't understand the dictates of Epidemic Act. Now political issue, now it has become the vaccine manufacturers issue. Very sorry state of affairs across the globe. You are forced into fear psychosis and they are forcing you to submit yourselves at the cost of your own existence. Having regular exercise, eating good food, exposing yourself to sun, these are all natural and fundamental to your natural immunity. Major sources. And being happy when you...
Can you see, Dr.
Yes,
Dr.
yes.
Reddy, can you see this slide? Can you see this slide which I am showing now?
Deaths from COVID-19
This slide.
in some Western countries. Is this the one which you wanted to show?
Yeah.
Yes.
Is it okay?
Very much
Like-
okay. I'll read it for the people. Then after that you can...
I just concentrate on the deaths per million. These are the Western countries. Just see, deaths per million are in 4 digits. Just remember this. This is in 4 digits. USA is almost 2,000 per million population. And their median age is almost 40 years. And their overweight is 60% plus. 60% people are above BMI 25. And all of these countries are almost 60%. If you see Brazil is very interesting. It's a Latin American country which is having a very high death. But the age is much less, 33. Median age is less. So it is a developing economy like India. But it has got a very high obesity, 56. Because if you see, once we come to Asian countries, we will see that the obesity rate is 20 to 25%, including Japan. So the Westerners are 3 times more obese, and Brazil is also 3 times more obese. So Brazil is having a very high in spite of a lower age. So if you see most of the UK and other things, and Sweden, if you see Sweden did not have lockdown, but it also has got a fairly obese and it has got an elderly population. Median age is 41 years, or median age is 20 years, Asian countries. So it has got a death rate is less than the other European countries. Sweden was criticized. Similarly, this is
Turkey.
So anyway,
Well, don't remove this, sir. Don't
So
remove
this
this.
is-
Sir, Banerjee, Mr. Dr. Banerjee, don't remove this. Let me put it this to the world, to Indians. all those who matters, right from union government to state government, ICMR to DCGI and every state health ministry and directors of health, kindly see this chart, how people are dying per million, how many are dying per million, why they are dying, what is the median age, and what is the overweight. This is where I have been shouting from the rooftop. Indian traditions, Indian culture, Indian food, Indian lifestyle. Why the hell you are trying to create panic in India? Yes, sir, please go ahead.
I want to show now the Asian countries and the African countries. Let us see if I can get it. South Asian countries, do I get it now?
Yes, sir, it is on the screen.
See, it is only 3 digits. Except for Russia. Russia is by mistake, it has come Russia and Iran because they are also European countries, Russia.
Okay.
You see, these are in 3 digits per million. And you see the median age is less, we have got younger, and the obesity is in the 20s. And Russia is 60, that's like European country. And age is almost 40. Japan is the highest age, 48, higher than European countries, but the obesity is 24. So, and the mortality is even lesser than India also. Mortality is lesser than India. So you see the pattern almost 7, 8 times, 10 times difference just by being not overweight and being younger.
I think is this not enough, even right from Supreme Court to High Court? Is this data not enough for you not to mandate, not to create fear psychosis, under-tested, under-trial vaccines? Why should you? The data is very clear. Why people are dying, how people are dying, how many per million they are dying. Everything is on the record now by a scientist. Yes, sir, please go ahead.
Now I will see some, even similarly, there is very interesting difference in the African countries. You see, there are some African countries which has got high obesity like South Africa. Obesity is 53, whereas other Africa and Egypt has also high, but it has got a less. Among the African countries, 2 digits, where Nigeria 12, Ethiopia 40. It is even less than Asian countries, but African countries which are having high obesity and median obesity is having a higher like South Africa. So obesity is coming up as a major risk factors.
Now one point, sir. One point. Let me through Mr. Dr. Banerjee. Let the whole world hear. South Africa has been defamed for malnutrition, but you see how many deaths per million. How many deaths per million? This is what actual data is all about. Malnutrition, you say, you project so many people, how they you try to project their skeletal structures, but the mortality rate per million, why even this is less than Indian in some African countries? Kindly understand, this is what the science and data is all about. Yes, sir.
So anyway, I'll come back to my earlier presentation. How I go back to my earlier presentation.
But wonderful, sir. Wonderful. So I think anyway, at least.
That's why I have.
Yeah, you have gone back to your original, because this is a revelation, right from Supreme Court to High Court, Prime Minister to all chief ministers. Chief ministers, so it is a state health subject. Health subject is a state subject.
So you see the diet.
Yeah.
This I would say this is the social epidemiology. If you see the culture, this is the Japanese diet. I have chosen because it is having the lowest mortality in spite of the highest age structure. Because of so I just don't know of Japanese food, but it appears to be healthy food and some lot of vegetables and fruits and other things. Similarly, Indian diets, different cultures. The traditional Indian diets are also less fattening and less obese. So Indian diets, and now this is what is we are American food. This is also Indian also we are having now American food in the urban. Like the second wave, the middle class was affected more, and most of the middle class are going the African way with McDonald's and other things, the pizza. And what happened in the lockdown? You can't go to the restaurant, you order takeaways. And takeaways, you are just seeing TV and indoors and eating, no exercise, no vitamin D, no outdoor exercise. Within 1 year, people have put on weight. They have done studies in America. This is change over the year. This is from an American magazine I have taken. They found that people, so after 1 year, second wave, third wave, you will be more vulnerable because you are putting on weight. You are just going for the risk factor. They have found the highest risk for mortality is overweight. Second highest risk in a published study, peer review study, they found the fear, panic. In fact, one of the principles of public health is to allay the fear of the population, to mitigate the fear. Here, throughout the pandemic, the whole world, authorities and governments have kept on increasing the fear, which causes high mortality. They have done studies now, published study. I can give the reference. The after obesity, the second risk factor was fear and anxiety. People who are having panic and anxiety, their mortality from COVID was more. Because you see, it is physiological. Adrenaline increases, the cytokine storm or respiration increases when you get excited. So breathlessness increases. So all those things and obesity and other things. So this subsequently we are having the man-made bad health. So India also, it's a peculiar, even a foreign epidemiologist noted that in India, those who are very old, they do better than the very old in the Western countries. So they, of course, they are anecdotal. That you see, there is. I was just seeing a very interesting study, recent study from New Zealand. New Zealand, Australia having very severe lockdowns with hardly couple of cases because they think they can keep the virus at bay. It is not possible. It is not possible. The population will always remain vulnerable. And there's a very interesting study from New Zealand. They found that children are suffering from poor immune response to other pathogens also. Because when a child grows up, the child is exposed to number of pathogens. Some are harmless, some may be mild, and that's why the COVID also, it is very mild in children. Because what happens in children, physiologically they can have an immune system is developing, and like you use a muscle, it becomes stronger. So the more to the external environment they are exposed, they have got a thymus, they have got a very big thymus physiology. Do not have ACE receptors where the COVID virus attaches. So that's why it gives them immunity from COVID. They have a high melatonin. So these three factors, high thymus gland, lack of ACE receptors. So there's a physiological reasons for children. And if they are exposed to this, they get lifelong immunity. Even they have found studies that from Singapore, University of Singapore, from Sweden, Karolinska Institute, they have found that people who have never been exposed to the novel coronavirus but exposed to earlier SARS virus or other coronaviruses, they have launched a T-cell immunity against the novel coronavirus. So people who are, so New Zealand, there are concerns. Some immunologists have expressed concern that these children will grow up with social distancing and too much of this hygiene hypothesis, which was always there. That with that, the immune system is not, and when they grow up, they will be always susceptible to any pathogen because the immune system is not exposed to viruses. We are exposed to different viruses, pathogens, and then the child develops so particularly people from poor countries, the elderly, those who have gone through a rough life, they have been exposed to, they have got a better immune system to their Western counterparts. So that's why these are some anecdotal 100 years old and 105 years old. Of course, I'm not giving much here on this, but people give on one serious case, they say it has got a very severe. So similarly, you should project the survival also, that people are surviving, octogenarians are surviving, and of course, people die of so many years. So this is the other demographic factors that lockdown, you cannot break the chain of transmission in such slums and other things when you do lockdown. In fact, you are increasing the transmission, and that's how we got the herd immunity. And the second wave was hit those people who were sheltered in high-rise buildings. In fact, we did a study last year after the first wave in October. We found, we did a sample survey of 5,000 people in Pinti, Chinchwad, a population of 30 lakh. We found that in the slums, the seropositivity was 70 to 80% in some of the slums. And in the high-rise building, it was just 5 to 10%. So when the second wave occurred, none of the slum people were affected severely. None of the slum colonies were affected severely. And the majority of the cases were in the high-rise because 70% was sheltered. So these lockdown and restrictive measures cannot prevent it. It just postpones it and keeps the population vulnerable. Not to say that you just don't take care. We go by the public health principles. We have identified people who are at risk. All well-to-do are also not at risk. Young well-to-do is healthy, is not at risk. He can go to school, he can go to people, elderly people with comorbidities, hypertension, treat the hypertension, treat the diabetes, your risk comes down to normal as a normal person. So it is the neglect of other diseases which makes you vulnerable to it. And I am afraid now, we are talking of the third wave in children. I am afraid that because of the loss of economy, loss of livelihood, many children will be malnourished. Large number of children will malnourished. And that perhaps can make them vulnerable to any infection. It may be COVID and you will find a RT-PCR and then you will say the child died of COVID. The child may be dying of malnutrition. So this is my concern. Another public health principle I have seen which has been breached, because I have been an epidemiologist in the armed forces. I have myself gone on ground, investigated respiratory epidemics. I have in fact, I have investigated. I was in the thick of a pneumococcal outbreak. It is also again respiratory, and I had a microbiologist with me, and there were a large number of cases. Whole ward was full of pneumococcal pneumonia and bronchopneumonia. So I was, we were trying to isolate the organism. So I said, you take the throat swab, you take the nasal swab. I said, you are finding pneumococcal here, so it is due to Bolta. No, these are commensals. Any large number of normal people, pneumococcal. I was in the armed forces, we used to get meningococcal meningitis outbreak. So when I used to, I learned from the microbiologist. You just take, Bolta, no, we have to take blood culture, or we have to take the and other things. Then only we say, yes, it is due to pneumococcal. Otherwise, then we
Voice, sir, loss of voice. Dr. Banerjee. Dr. Banerjee.
saying the rents and 25 people.
Loss of voice.
Yeah, you can't hear at all.
There was just loss of voice in between.
Can you hear?
Now okay. Suddenly there was loss of voice.
Now you can hear. So what I was saying is that this another public health principle which has been I think which has not been taken care of, ignored, is that just getting an organism. As I said, I was in the armed forces. I have been investigating in the field epidemics long back. That's why I said I am a traditional person. Perhaps things have changed now. Long back, I had a microbiologist with me, and we were investigating a pneumococcal outbreak. I said, if you want to isolate the organism, why don't you take the throat swab? Why don't you take the nasal swab? Respiratory. We found pneumococcal. I said, is it to pneumococcal? No. Many healthy people carry the pneumococcal. Similarly, we had meningococcal outbreaks. He says, just carrying it in the air, we cannot label it a case. You have to isolate it from the blood. You have to isolate it from the deep in the lungs, transtracheal tract, or you have to isolate from the CSF, meningococcal. So here it is very surprising that here asymptomatic people just having a RT-PCR, and RT-PCR is not an organism also. Whereas when we used to isolate pneumococcal, meningococcal, 5-10% healthy people we found, we never labeled them as cases. Even when we found organism in the throat, we never labeled them as cases. At the most, they are carriers. So they were not, healthy people carry so many organisms. Even typhoid organism people will carry. You don't isolate, quarantine them. You don't. So that is surprising here. Here we are doing RT-PCR, which is not even identifying the virus. It is identifying only one particle of it. And you are labeling as case. So this is something which is a matter which requires debate actually. I am not saying who is right, who is wrong. They may be more right because the technology has advanced. But we have not been able to check it. No, we had to be able to check it. I said, yes, it is good. Lockdown works. This testing, tracing works. From China to Chandni Chowk, the virus has come. So that means you have contact tracing and other things, and all these things are not working. So why harass the population? Why cause economic loss? This from the public health is about lives versus lives. It is not life and economic. Only COVID death is lost to economy. There are bigger loss to economy from malnutrition, bigger loss to health and life from loss of livelihoods, loss of occupation. So that is public health. Public health is economics also. Public health is not only one disease. So this is a debate. Debate is whether to, and now we have got the vaccine. It's a very good thing. I am not against vaccine, but vaccine we should follow the public health principles, because these are vaccines which are yet to be, I mean to say, ki resources we require, particularly in a country like India, 136 crores. Simple thing I have to say, UK is a country of 6 crore, Israel is a country of 1 crore. They have vaccinated 80% of the year, but still the cases in UK is 20,000, 30,000, India is 40,000. Israel has done. Can we afford to vaccinate 136 crores and later find the vaccination is not checking the transmission? Won't it be 36,000 crores we are spending on vaccination? And that too, just two doses for 75 crore people. So now we are going for third booster. I was just reading there in Israel, they are thinking of fourth booster. So can we afford that? And do we require it? Because as it is, recent evidence as our sero survey also shows that 60 to 70% of our people have got antibodies. Then these antibodies means 80% people have got the infection because antibody levels come down, but the T cells and the memory cells are activated. So at least 80% of our people are. So is it helping this extra vaccine? I would be all for mass vaccines. It helps. We have not been able to really, no country has been able to check it, and we have got an advantage. Younger population already with some level of natural infection or maybe some vaccine, 5-10% or 20% vaccine immunity and 80% from normal infection. Now we can consolidate and concentrate on the high risk people, those who are vulnerable, those who are say obese, those who are elderly with comorbidities. And you may consider children, healthy children, certainly not, because elderly people, you can, even if the vaccine has got long term, we don't know long term, it may be, there may be no effect at all, that's a different issue. But suppose if they have the child, we cannot, and it is irreversible. Any harm done of a new product, it is irreversible harm for a child. For an adult, for an elderly person, he or she has few years ahead. But for a child, the whole life is ahead. So you have to keep that in mind. At least still we are more comfortable with it. And other thing I am seeing from my public health experience, that I am collecting data on measles, and I have been discussing with other people in the field. The actual vaccine, which are well established vaccine like measles and conventional childhood vaccines, are getting neglected. I mean, the people are not coming. In COVID time, they were not coming out of fear. Now the whole staff is mobilized towards the COVID vaccine. And do the children require it over other vaccines for childhood vaccination, firstly? Secondly, we have got a very, do we have the resources to monitor the adverse events? Adverse events, like we want to give to everyone to remote areas. Remote areas, we don't have the infrastructure, because to monitor the adverse events, you require the infrastructure. It is like we are going for a bullet train or we are a super fast train on old tracks. So there is a danger of derailment. It's common sense. It's not require too much of here that. So we require data. No, we don't have data. Then the care of non-COVID should not be interrupted. Like what happens, you neglect the care of diabetes, hypertension, COVID mortality will increase. So this is public health, that holistic care of all conditions. And research is required, and research on everything, research on mask, research on social distancing. These computer models is not research. Computer models do not take the ground realities. And research should be our own country research, not all. The social conditions are different in the Western countries, social conditions are different in our countries. Way forward, increase in health budget and all, public health, equitable distribution, low individual. It has got a very low individual risk, COVID. As brought out, 99.9 survive in India. India mortality, all India mortality is 0.1. So individual risk is less, but large societal risk, because it's a large country where large numbers come. And how do large numbers come? Because you are doing testing of everyone. Naturally, there is panic. So if you just do the testing of the high risk people or those with symptomatic people, you will be able to conserve your health services and treat the severe and moderate cases better and bring down the fatality still lower. Then control obesity, promote health food habits, lifestyle, sugar and soft drinks, fast foods, physical activity, playground, swimming pool, all were interrupted during the lockdown. Schools are still closed, so their children's health is at risk. And conclusion is, if you know the enemy, know yourself, you do not fear. You know the enemy now. You know that coronavirus is just like any other virus. And you know yourself also that if I am obese, if I am diabetic, if I am not doing exercise, I am unhealthy food, So if you know that, you will win then if you know yourself but not the enemy, initially we neither knew the enemy, just running amok, chaos. Hospital services were overwhelmed, quarantine and everything. So if you know neither the enemy nor yourself, you succumb in every battle. Unfortunately, what is happening is now we know the enemy also, now we know the ourselves also. But our strategy is not being directed by this knowledge. Our strategy is not being directed that the mortality in our country. Western country can afford to go for COVID all out because they do not have any other communicable disease. Our country, we have got diarrhea, we have got malnutrition, we have got typhoid, we have got a vaccine for typhoid. Have we gone for that? Eradication. We have got tuberculosis. Every day 2000 or 1200 to 2000 people die of tuberculosis in India. 1200 to 2000 people die every day from tuberculosis. Every day 500 people die, young people, 500 young people die from road traffic accidents. Road traffic accidents. I was seeing a judgment of a Supreme Court that Kerala wanted to open the school offline exam. The Supreme Court judge said that even if one child gets infected, who is responsible? So I would ask the judge, are you stopping the traffic even one child gets killed in traffic accident? Because what I'm saying is, I'm not denying risk. Risk is there. Life is full of risk. But public health takes risk in perspective. We have got more traffic accidents. We are talking of long COVID. 500 young people die of traffic accidents in India daily, and 10 times more are disabled for life. Long traffic. They are handicapped, they are paralyzed for life. Isn't that worse than long COVID? I agree, COVID is a problem. We do research. But you have to take the perspective. 500, I'm so many people not know if 500 young people die of road traffic accidents in India. I am very sure. I am very sure people are not aware that 2000 people die of, children die, 2000 children die every day. Dengue, we are not counting dengue. We are not counting typhoid. If dengue, you may find, you will close school throughout because dengue is there for 6 months in a country, 3 months in a country, post-monsoon, dengue is there. And the mosquito bites in the daytime in the school, half pant pen ke bacche school jate hain, and you can't tell the mosquito to keep social distance. So these are not possible in a country. We have got, if we start counting them, you will not walk out of your house. That fear can be created just by giving publicity to any disease. If I take dengue and I start counting, if I take typhoid and I start counting, you will just be not immobilized. So we require public health. I am very happy that COVID has set up a surveillance system. So as a Indian, I would like this type of surveillance system for all communicable diseases in our country. Why only COVID? Why not dengue? Why not typhoid? Why not tuberculosis? And then we will know that this comes much lower down, not only in our country. As I was saying, 7 countries they have done in Europe, they have found that 0.3% deaths are due to COVID in children and 99.8 from other causes. So I am very sure in our country, this will be still lower. And 36,000 crores for just vaccinating 75 crore 2 doses have been set aside. And for water and sanitation, 20,000 crores. So almost double amount and vaccination for a disease which is having such low mortality. And majority of our area is from poor sanitation, poor and other things. So this is public health. That's why I am saying, I am questioning, am I missing something? Then this common sense is lacking. I am not talking of rocket science. I am not talking of complex mathematical models. I am just talking of common. घर में आदमी करता है कि इतना पैसा है तो कौन सा ज्यादा जरूरी है. The country can be afford to go blindly. I think this is. I would like the discussion among people who have got. Who like to think for themselves rather than go into panic mode. Panic mode. All diseases can be. Any disease can be taken up, and panic mode can be created. So these are some of the references. I have got many references. I just quoted the figures, facts and figures, and.
Wonderful, Dr. Banerjee. I think you have really ignited India and the world. This is normal common sense. We don't need rocket science. So, I hope now it is very, very clear, abundantly clear to everyone that You don't need rocket science in this age. You need common sense. The common sense is a very less mortality, 99.99% when they recover. Why the hell this fear? Why the hell this panic? In the first instance. And then he has reeled out the statistics because he is an epidemiologist and a community medicine specialist, and he's a scientist. His experiences with other communicable diseases in the past, that survey has led to this live show very clearly exposed how vulnerable Western countries are because of the obesity and how many per million they are dying and how. And he has compared Asian countries. Believe me, how African countries less mortality rate in spite of malnutrition, which we see every day and day out. India, some African countries are faring much better than India in mortality. Then very clearly pointed out 35,000 crores for vaccine, water and sanitation just 20,000 crores, communicable diseases because of water and lack of sanitation. And how is that vaccination under trial, untested, under emergency use authorization, because it has not gone through all needed scientific peer review methods and all, haphazard, as you have seen the variants keep changing, how immunoescape, Pathanamthitta, Kerala also reported, likewise so many other states and in different countries. Why the hell you need so much? Don't you think India is much, much different when he has shown very clearly the food intake, the obese, the young age? These are all solid factors which will propel India not into panic states. If you want panic, 27,000 more people are dying every day. Wow. How many corona is accounting in that? He has very clearly mentioned children, 2,000 because of tuberculosis. Daily accidents, 500. That's what I was trying to mention right from Supreme Court to High Court, Prime Minister to Chief Minister, this is a health subject, ICMR, DCGI to all, Department of Health and all those concerned. Why do you create panic? It is pandemic everywhere across the globe. Why the hell you need RT-PCR? Everywhere it is spread now. Through natural immunity, herd immunity. As he has pointed out through serological studies, 70 to 80% have got antibodies. And not only that, he very clearly mentioned that these T cells, which you have inherited, memory cells, they can fight any variants. That is the beauty. Joppadpatnam, they were all safe than high-rise buildings. Colonies where people are going out to play, speak to each other. Without your knowing it is spreading or you are gaining antibodies. People like us who have been around with all those who got infected through RT-PCR, how 100% you can guarantee that RT-PCR is the real finder of corona because it identifies only one particle, not virus, as you clearly mentioned. How can you take this? The courts have to come to the conclusion. Where is law and what is legality? What is science? What is logic? What is evidence? When you are dealing with human lives, not machines, believe me. And every human, he has got right over his body, which medicine, which treatment, where to go and how to go. How can you destabilize his mobility just in the name of pandemic? Ridiculous. Masking, what happens? He clearly stated after 6 hours, you know, moisture. The second phase deaths, is it because of this? Why are not we studying? What is the effect of lockdowns? What is the effect of masks? Physical distance. Sitting at home, not exposing yourself to sun, morning sun, it gives energy and vitamin D, which is very, very vital and quintessential for your natural immunity. We have been shouting from the rooftop. And what about those sitting at home during lockdowns, losing employment, if they are not in a position to provide nutritious food to their children, to their family members, are they not going to get exposed? Not just corona, so many other communicable diseases, as he clearly mentioned, diarrhea to dengue, tuberculosis to pneumonias. How dangerous corona is in them when you compare that. That is what science is all about. That is why we wanted guests like Dr. Banerjee, who has come out with such clear picture of how corona has created, how in the name of corona, those who are supposed to administer welfare and development created a panic because of lack of understanding, I say, lack of proper scientific knowledge, understanding, and logic. There is no survey on anything what they have advocated. Keep changing the protocols. WHO to ICMR, DCGI blindly followed by Prime Minister to Chief Minister. What is this? Indian traditions, what happened to that? Which is Indian medicine? We have been shouting from the rooftop. What happened to Anandaya's Ayurveda Corona medicine? Naturopathy. Kadarvalli has challenged you through his diet. The nice therapy of Rai Chaudhary. Many are there because of them and because of our own kitchen. Our own kitchen, we have got our own traditional medicines in that which gives you immunity. That is why Westerners have gone for patency over our own turmeric. Our people are sleeping here, including neem, Azadiracta indica. That means we are not understanding what India is all about. Indian traditions, Indian lives, it's a tropical country. Vegetables to fruits, sunlight, lot of sunlight, playing areas. And then the beauty is the herd immunity, natural immunity. When you contract infection, being asymptomatic, you are generating antibodies without any fear. Now you are creating flutter to test everyone. If I want to go to Hyderabad, from Hyderabad to Kochi, vaccination, what is this nonsense? What is the evidence of immuno escape? Whom are you trying to benefit? This is the money paid by the people of India, taxpayers' money. You should spend it in a transparent and an accountable way. Why the hell you should run around and then scare them into submission? Why is that Supreme Court still sitting on the petitions right from May and still allowing all those mandates to go on compulsory vaccinations and everywhere? My personal liberty, my right to life is at threat. What are high courts doing? This is $1 million question. That is why people should understand anything which is not proven and anything which is not required should not be allowed into your body. And that is what science speaks, logic speaks, because he has clearly established that obesity, and then the second thing is fear and anxiety. The government should have taken people into this thing, stating that nothing will happen when you started staying 99%, 99.9%, nothing will happen. Then for that 0.1%, in that to 85% may require oxygen, and in that 0.1%, 15% may require what you clearly stated, ventilators. Then how is that you are imposing these vaccines? What happened to natural immunity, herd immunity, our traditional food, traditional lifestyle? Why the hell you should ape countries? You have seen, as he clearly mentioned, Israel 1 crore. 3 to 10 crores is UK. What is our population? 130 crores. How many deaths because of corona? Come on, debate. Why this fear psychosis? Now, at least, आज दूध का दूध पानी का पानी. Dr. Banerjee has made it very clear, at least from here onwards, Supreme Court to High Court, Prime Minister to Chief Minister, ICMR, DCGI will not dictate terms to people, and all these mandates should go off. Yes, prevention is better than cure. As a doctor, I will always say, let us prevent. But at the same time, let us understand. Now we know the enemy. Now we know ourselves, our natural immunity. Then why this fear psychosis? Why these imposed mandates? Why should you ape Western mandates? Our country is different, our tradition is different, our bodies are different. Though we are humans, this has to be borne in mind. Everyone has the way to lead their life. Everyone has right to lead their life. Every individual has got his own particular immunity, specific immunity. But if you create fear psychosis, as he really pointed out, even a small thing, from a mole, you can make it a mountain and make people to succumb and die because of that. If you create, he has clearly stated, adrenaline, how your respiratory rate increases, heart rate increases, how you become panic and get hospitalized. When you go to hospitals, what is happening? They'll ask you to sign. Vaccination also, they are making you to sign. If you are sure, why this emergency use authorization? Remove all that. Let them become liable and be compensated. So, all these things, even your ringtone, it clearly says, even after vaccination, you wear mask, physical distance. That means they are not sure. And unsure minds, unsure policies, how can they dictate and how can you make people to succumb? I hope people will understand at least now to come out of this fear psychosis question, as he rightly pointed out, as a scientific man, he will question. Let government answer. Let government answer. We have been questioning through this channel. Case sheets, those admitted. What are the treatment protocols? Why did you follow those treatment protocols? How many of them survived? As a doctor, I wish everyone survives. Unfortunate, those who have died, did you conduct autopsy? Why you kept on changing right from chloroquine to cocktails? WHO banned everything, remdesivir. You still continued. Till May 2021, governments were distributing. Lakhs of rupees people spent, still they died. Many those who have recovered, still suffering. Whose negligence is this? Don't people have right to question? Now under the Epidemic Act, allowing police to get people into fear psychosis, will it last? Let science and logic, wisdom and evidences prevail, because it is concerns with everyone's health. Because ultimately it is life what matters. Until and unless people are healthy, only then nation can be wealthy. And people, if you want them to be healthy, remove fear psychosis. Make people well informed. Now you know the enemy, you know yourself. Let people become informed. Let people be a participant, because it is all in the interest and welfare of the people. Don't forget, India is a republic. It's not a banana republic. Every citizen is a constitutional authority himself, because we have dedicated constitution to ourselves. The courts have to take cognizance of that. Thank you, Dr. Banerjee. Hope to see you soon with another
Thank you.
feature.
Thank you, Dr. Reddy.
Very kind of you.
It's a pleasure.
So for all the people in India,
I want
go ahead, sir, please.
one last message. I have we should use this whatever infrastructure of for all diseases, not one disease. I should not be taken that I am anti-vax. I take typhoid vaccine every 3 years, because I have investigated outbreak of typhoid. I have investigated. You just put my name, typhoid outbreak. You put my name, pneumococcal outbreak. You put my name, tribal malaria. So I have investigated almost all the major communicable disease in India in my career as an epidemiologist in the armed forces at different parts of the country. So I know what is actual threat. I have investigated and I take typhoid vaccine. I was hesitating. In fact, I was hesitating to take this vaccine. I am elderly. Luckily, I don't have diabetes. I don't have heart disease. So I was calculating the risk. I said, okay, if I am elderly, I am 67, I get corona 67 में without comorbidity 2% है, ठीक है, 98% I will survive. अगर मेरे को कोई कैंसर हो जाता है तो सर्जन बोलेगा यार तेरा 80% चांस है, 90%. I am ready to take that chance at my age. Even at my age, if the mortality is 5, at this age, you have got so many, 20,000 people die of heart disease and other disease. So, I mean, you have to come to terms, no? So even at an elderly age, even 2% risk is I am ready to take. So then I said, यार vaccine कहता है कि 92% बचाएगा death से. मैं बोला यार normal infection तो 98%. I asked the senior professor of medicine. He said, यार you have not taken vaccine, anti-vaxxer. I said, sir, I am following the data. I take typhoid. I know कि it gives good protection. And इसमें ये 90 मेरे age में 98%, 97% I will survive even if I get corona. एंड वैक्सीन बोलता है कि 90% बेनिफिट है, तो फिर भी तो ज़्यादा हो गया ना. आई मीन हमको तो आता नहीं है मॉडल, हम तो सिंपल बताया. तो ही कुड नॉट आंसर मी. मैंने बोला सर ये क्वेश्चन का जिस दिन आप जवाब दे देंगे मैं सबसे पहले जाके वैक्सीन लूँगा. तो उसका जवाब नहीं दे पाए वो. तो इसके दौरान क्या हो गया, आई हैड टू अंडरगो अ सर्जरी. आई डेवलप रेटिनल डिटैचमेंट. सो आई हैड देन आई वाज पुट ऑन स्टीरॉइड्स. आई वाज हेजिटेटिंग कि लेना है कि नहीं लेना. आई वाज ऑन स्टीरॉइड्स. तो ऐसे स्टीरॉइड में लेके वैक्सीन लेके तो कोई फायदा नहीं है, तो जाने दो, जब बाद में देखेंगे वैक्सीन लेंगे. तो स्टीरॉइड खत्म हो गया. उसके बाद दूसरा सर्जरी करना था, तो मेरे को सर्जन ने बोला कि यू गेट अगेन अ ब्लड शुगर करा लो आप. हालांकि आई एम नॉट डायबिटीज. हमने बोला चलो यार एंटीबॉडी भी करा लेते हैं. सो जब मैंने एंटीबॉडी कराया, आई हैड नॉट 10 times हायर आईजीजी लेवल्स देन द नॉर्मल पर्सन. In fact, I had much more IgG levels than my other professors who had taken the vaccine. मैं बिगर मतलब वैक्सीन लिए मेरा IgG, मेरे को एसिम्प्टोमेटिक कब हो गया मेरे को मालूम नहीं. And that too during steroid. Last 15-20 days में हुआ होगा. तो मेरे को एसिम्प्टोमेटिक हो गया और मेरे को अभी भी एंटीबॉडी लेवल मेरा 10 टाइम्स ज्यादा है नॉर्मल बेसलाइन से.
God bless you. God bless. That's what.
Without any vaccine or
Yeah,
without
that's what. See,
अभी फिर मेरे को बोलते हैं कि अभी why should I take a vaccine? Because अभी बोलते हैं कि even after recovery from natural infection, I have to take a vaccine. Why should I take after natural infection? I mean, that is anti-science. I mean, I am ready to challenge anyone.
this topic will debate, sir. This topic will debate. This topic will. No, Dr. Banerjee. This topic, those who have recovered, why the hell they should need vaccine? We will debate on that next topic. And next topic, we need to dissect and. Yeah, we will take that even because now.
Because here we save a lot of money.
That's what. Yes, we have to save a lot of money and unnecessary panic also. There is last one question to you as an epidemiologist. Can there be a wave wherein old get affected in first wave, middle age get affected in second wave, third wave children? ये virus कहेगा क्या? This age I am going to affect you in this wave.
नहीं ऐसा नहीं है. अभी जब बच्चे लोग भी अफेक्ट हो गए ना, अभी जो सीरो सर्वे किया कि बच्चों में बड़ों में ज्यादा फर्क नहीं था, घर बैठ के we have not protected the children.
No, that's what. See,
It's
simple wave. How they have to, because you are an epidemiologist, you are a community medicine specialist. A virus, does it say this time I am going to affect only old age, next time only middle age, and third wave only children? Children were
उल्टा जाता है, नीचे से ऊपर जाता है.
Children were not part of the family. Children were in somewhere in Russia or America when first and second waves were happening. They were not there with the family during lockdown.
The first to get any infection. It is the other way around. If you roll out childhood vaccination, the disease goes to upper age. क्योंकि upper age immunity कम रहता है. पर बच्चों की तरफ नहीं जाता है क्योंकि बच्चों का immunity बहुत अच्छा रहता है. So it is only one way traffic. If you vaccinate young people, the disease moves to the older age group. But vice versa, one way traffic है. Older age group का वैक्सीनेशन से नीचे की तरफ नहीं आता क्योंकि चिल्ड्रन का नेचुरल इम्यूनिटी बहुत तगड़ा होता है. थाइमस ग्लैंड होता है. इट इज फिजियोलॉजी. आजकल के डॉक्टर पढ़ते भी तो नहीं है ना. 1.5 साल 1 साल में वो एनाटॉमी फिजियोलॉजी कर लेते हैं. हम लोग 2-2 साल में 6-6 महीने फेल होके करते थे. हमारे टीचर एक गलत बोल दिया फेल कर दे. अभी क्या, अरे यार पास कर दो यार पास. तो अभी क्या इतना डाइल्यूट हो गया कि ना उनको फिजियोलॉजी आता ना एनाटॉमी आता, डॉक्टर बन जाते हैं. हमको अभी भी मालूम है, बैक बेंच में बैठते थे, पर अभी भी याद है कि यार बच्चों में थाइमस इतना तगड़ा होता है, एकदम बिल्कुल आर्मर जैसे होता है. टी सेल थाइमस बनाता है. बच्चों में इम्यूनिटी तगड़ा होता है, इम्यून मेमोरी हो जाता है. प्रोवाइडेड यू मेक द चिल्ड्रन मिक्स. अभी बच्चों को आइसोलेट अभी न्यूजीलैंड में हो रहा है. आप गूगल सर्च कीजिए, न्यूजीलैंड चिल्ड्रन आर लूजिंग इम्यूनिटी, इम्यून स्ट्रेंथ दे आर लूजिंग. जैसे मसल वीक हो जाता है, उनको इतना आइसोलेट कर दिया कि नाउ द इम्यूनोलॉजिस्ट एपिडेमियोलॉजिस्ट आर वरीड कि दे विल ग्रो अप एज वेरी फ्रेजाइल एडल्ट्स.
Vegetables. You are making them a vegetable.
जैसे हम मोटरसाइकिल में जाते, कार में जाते, हमारे मसल्स पैर के वीक हो जाते हैं. सिमिलरली अगर हम इतना आइसोलेट और 10 बार हाथ धोएंगे, जो 10 बार हाथ धोते थे उनको सबसे पहले हुआ जो सुपरस्टार थे.
क्योंकि then they should understand, हाथ में भी कमेंसुअल ऑर्गेनिजम्स रहते हैं. जैसा गट में अपने पेट में रहते हैं, हाथ में भी रहते हैं. उसी से हमको सहज रोग निरोधक शक्ति मिलता है. राइट सर, टेक केयर. I hope we have answered everything what I've been watching on the screen. Let me leave an old man, Dr. G. He is just recovered for so minutes so that he will come back to my channel regularly. I will not hold him for long because he has given me the best scientific evidence. Enjoy doing live show, and Dr. TSPR channel is proud to have wonderful guests like you all coming to the channel with evidences, because this channel is very clear. It takes up the issues as per rule of law, constitution, invoking evidential act. No enmity against individual, nor animosity against any party or organizations. That is why we keep repeating, support Dr. TSPR channels. DR means doctor. Dr. TSPR channels, citizen Dr. TSPR channels, and environment people. Tomorrow you watch this retelecast on Citizens Dr. TSPR channel, 8th September at 11 a.m. So kindly support. I have been requesting you, with your support only we can move ahead. At the same time, any evidence you can share. We are here with some wonderful guests. I thank them a lot from the bottom of my heart. Because of these guests, their knowledge, their experience, they have presented at that age, recovering from so many things. He has come out. He said, now let me present. This is my area, my arena. How is that we are not questioning? So, through Dr. TSPR channel, all these esteemed guests have been questioning the people who matter as to why masks, why lockdowns, why this physical distance, why mass vaccination, what happened to natural immunity or herd immunity. When 99.9% recover on their own, why are you taxing those 99.99%? Why Supreme Court to High Courts are keeping quiet when it comes to right to life and personal liberty? These are all the challenges. And why is that in a tropical country like us, we are not allowed to go out and breathe fresh air, sunlight, vital, quintessential? Why are we not being allowed to eat what we are supposed to eat? Indian traditional diet and live Indian traditional life. That is what is all about corona and any other diseases. Don't panic. No obesity. Don't panic. Take care of yourself. To all those in India, Sukha, Nidra, Shubha Ratri. To the world across, good morning, good afternoon, good evening. Thank you, Dr. Saab, once again. God bless you. Thank you.
Thank you. It was a pleasure.
Thank you.